Right, good evening everybody and welcome to December's meeting of the Customer and Corporate Services and Scrutiny Management Committee. The eagle-eyed amongst you will notice that we are back online, and this is due to the guidance that we've received around the current pandemic. You may also recall that the government guidance and legislation didn't catch up with online meetings, and so as such this meeting this evening has to take place as an informal meeting. I will just read you the caveat that we have on the front of the agenda this evening, just so that everybody's clear about the way in which this meeting takes place tonight. So it says, until the end of January 2022, the Council is reverting to holding its scrutiny meetings remotely in the interests of minimising any risks to the public, elected members and staff during the continuing COVID pandemic. Meetings continue to be held in accordance with statutory requirements. Scrutiny committees are non-decision-making bodies, and as such, this remote meeting will not be regarded as a formal meeting of the committee. It provides an opportunity for members of the committee to comment upon the business set out in the agenda without making formal decisions, and members of the public may register to speak as they usually would, although we haven't had any registrations this evening. So I hope everybody's clear with the context in which this meeting takes place, but to all intents and purposes, it will we'll conduct our business as we would do any other meeting. So if I could just remind everybody how these remote meetings work, because it is a little while since we've held one in this way. The first thing to mention is that obviously this is being broadcast live and recorded for posterity. In terms of the meeting itself, if you could just keep yourselves on mute unless you're speaking. And if you're wanting to speak with a new point or a new question, if you could use the function within Zoom to raise your hand, and I'll bring members in the order that I see them. If you're wanting to make a supplementary point or add anything to the item that's being specifically discussed, if you could just raise a physical hand, and as much as I can, I'll try to bring people in the context of the meeting. In terms of who people can see on the call this evening, you have the committee members around the screen, and then you also have Dawn Steele, who is the Head of Democratic Services and the Council's Statutory Scrutiny Officer. There'll be other members joining the, other officers joining the meeting as we progress through the agenda, and I'll introduce them as they come into the meeting. I have received one apology for this evening's meeting, which is Councillor Baker, who's unable to attend. And just before I move us on to the formal agenda items, I can see Councillor Pearson has a hand up, and so I will come to you.
Thanks, Jay. Just to give my apologies in advance, I need to go to Haxby Town Council for 7:30, so I need to leave this meeting at about 7 o'clock, should the meeting go on beyond that point.
Okay, no problem. If you could just pop me a note in the chat when you're about to leave, and I'll just record your absence. Okay, so moving on to the formal agenda then. Agenda item 1 is declarations of interest. Does anybody have anything they wish to declare in respect of this evening's meeting? And no, I don't see anything. So moving on then to agenda item 2, which are the minutes of previous meetings. Now we have 3 sets of minutes that we need to approve this evening. I'll take each one in order. So the first set of meeting minutes is for the 25th of October, meeting 1, which is on page 1 of your agenda. I have one amendment that I need to make to that, which is just in the declarations of interest. Just to be absolutely clear, that it says the chair declared a personal non-prejudicial interest as my mother sat on the steering group of the Human Rights and Equalities Board, and that's not entirely correct. My mother is on the steering group of the York Human Rights City Network and on the steering group of the York Disability Rights Forum, and is a member of the Human Rights and Equalities Board. So if that could be updated, and it'll be exactly the same in the declarations of interest on the meeting 2 from the same date. Councillor Fenton, I think you have your hand up.
Yep, thank you, Chair. I just wanted to propose some additional text into the minutes. This is on page 5. There's a paragraph that begins following input from Councillor Doughty. I just wanted to ask if we could add to the end of that sentence, excuse me, and I'll send Democratic Services this wording if members are content with it. Councillor Fenton raised a query about the scope of one of the report's recommendations and noted that council officers had undertaken to provide an analysis of the recommendations.
Yeah, that's the wording that you circulated to me earlier, isn't it,
Yeah.
today? I'm happy to accept that if all of the members are happy to accept that. So if I can just see by a show of hands that everybody's happy that I sign off those minutes. Thank you very much. I'm just going to note that I think Councillor Rowley possibly just dropped out. I can see that he's back in on the participant list, but not with his video on at the moment, which is fine with me. But if somebody could just let me know that Councillor Rowley is actually in the meeting, just so that we can keep a clear record of who's here and who isn't. I'll move us on then to just looking at the second set of minutes from the 25th of October that begin on page 7. Again, there was just a point that I think we need to just clarify, because in that meeting on the list of members present, there are 2 Councillor Taylors. There's Councillor Dave Taylor and Councillor Callum Taylor. And on page 9, it says that Councillor Taylor left the meeting at 6:32 and then Councillor Taylor returned to the meeting at 6:34. So if we could just clarify which of the Councillor Taylors it was that presumably had to pop off for a quick break, that would be good. But otherwise, I'm happy to sign those minutes if everybody else is. So again, if I could just see by show of hands that you're happy that I sign those minutes. Okay, thank you very much. And then finally to the minutes of the 1st of November, which begin on page 13. I don't have anything that I wish to amend on those minutes, unless anybody else does. Again, if I could just see by show of hands that you're happy that I sign those. Thank you very much. So that is everybody happy that I sign all of those. So we move on then to agenda item 3, which is public participation. But as I mentioned earlier, we haven't had anybody registered to speak this evening, which means we can skip straight on to agenda item 4, which is an update from the Director of Public Health. So if I could ask Sharon Stoltz, the Director of Public Health for York, to join us. And Sharon, I think you have prepared a short presentation for us, which you could talk us through. And then once we've received that, then I'll invite members to ask any questions that they may have.
Yes, thank you, Councillor Crawshaw, and hopefully the technology will work and I'll be able to share my screen. Of course, when I share my screen, I can't see you all. Can somebody just indicate for me that you can see that?
We can't see anything just yet.
Right. That is bizarre then, isn't it? Okay, let me try again. Right, can you see that now?
It's just coming up. Yeah, we've got it now. So now we can see the whole of the screen with the slides on the left hand side and the main side, and now the slides are full screen. That's perfect.
Okay, brilliant. Okay, so yes, my apologies to committee members that I wasn't able to share this presentation with you ahead of the meeting. As I'm sure you can appreciate, the situation with the pandemic, and particularly Omicron, is changing quite quickly. But I will share the presentation with you after the meeting, and I'm sure Democratic Services will be able to publish it on the Council's website as well. So you'll be familiar with these slides. This shows you what is happening in terms of our case numbers as at a few days ago. So I'll give you the most recent figures that we have today. So our provisional data, this is our local data, which is the most up to date. Our rate has increased to 433.6 per 100,000. So that's an increase from 395.2 to 433.6. And that represents 915 cases over the last 7 days. So as you can see, we are starting to see an increase in our cases locally, which is kind of what we expected. And as you can see from the national data there, in fact, York's increase is reflecting the rise in cases that we're seeing nationally as well. When we break that down then and look at where we're seeing the majority of our cases, it still is in the 5 to 19 and 10 to 14 age groups. And then you can see a corresponding rate in what will be the parents of those children. But as you can see, we're also seeing an increase in the rate of under 5s as well. And again, this picture is not unexpected, because the virus is very good at actually seeking out hosts that are not vaccinated. And so because the younger age groups are not eligible for vaccination currently, we were expecting to see cases spread into the younger age groups, and indeed that's what we're now seeing with the data. As you know, because we've discussed this before, we watch very carefully what's happening in the over 60 population in York. And that, as we've discussed before, is really because older people is where we tend to see the highest number of underlying health conditions that will make people more vulnerable to hospital admission, etc., severe disease if they get COVID. What we had seen was an increase in the number of cases in our older population, which is very similar to what you can see on the chart there for the Yorkshire and Humber region and nationally as well. There's been a very pleasing drop in the cases in older people, which is associated with the rollout of the booster program. So as we know, it was older people that were eligible for their boosters first, and so we're seeing the success of the booster program there. This data is quite out of date, so this is where we were in terms of hospital admissions to York Hospital on the 7th of December. And as you can see, there had been a decrease in hospital admissions, linked, as I said, with the last slide, to the rollout of the booster program. So older people and those who were clinically at risk, we knew that their immunity was starting to wane, but the booster program has had an impact on that. Nationally, we know that hospital admissions are starting to rise again, and there isn't any reason to expect that York will be any different to that. I haven't been able to contact the hospital to find out the figures for today, but as we know, the hospital continues to be very busy, not just as a result of COVID admissions, but they're impacted by staff having to self-isolate or to look after children who might have COVID, and obviously we know that they're still running a catch-up program as well. So these the data for hospital admissions for COVID doesn't necessarily reflect how busy the hospital is overall. Looking at deaths then, the bottom line being COVID deaths, that has stayed very low. The numbers are small, so you're going to see a bit of a jagged line at the bottom there, that bottom red line. But overall, the number of deaths that we're seeing for COVID is very low. And as you can see, we've had 162 excess deaths since the start of the pandemic, 2020. But that does compare quite favourably with the national figure, and we're very fortunate in York that we've seen fewer excess deaths than other parts of the country. This is a very busy slide showing where we are with vaccination uptake. So I'll read out some headline figures for you. So 87.5% of residents over 16 have now had the first dose of the vaccine, and 83.1% have had their second dose. So we're still playing a bit of catch up there in terms of residents coming forward for their second dose. For 12 to 15-year-olds, their vaccination programme, we've got just over 53% of our 12 to 15-year-olds have now been vaccinated. And as of yesterday, the 12th of December, we've had just over 70,000 residents who have received their booster vaccination programme. Now, you'll be aware from national media that the government has announced an acceleration of the COVID booster vaccination programme. There still has to be a 3-month gap between the second vaccination and the booster vaccination programme, but people are able to book their booster 2 months after they've had their second vaccination. I know, because I'm contacted by lots of residents, that people have experienced some challenges in finding free appointments in York to book their booster. So they receive a text or message from the NHS to say they're eligible to book their booster, and they go onto the website and they can't see any York appointments. We are doing the work, and I can assure the committee members that meetings have been taking place today and will continue to take place over the next few days as to how the city can come together again to support that accelerated booster programme. And there will be a call out to for any volunteers across the city who are either retired health staff who can support by actually vaccinating people, but also the other staff that are needed to support the vaccination programme, be that people volunteering to marshal people around or to support with the administration. So there's one person vaccinating and there's another person who can be doing all the paperwork, etc. This is not just the mass vaccination centre. Our community pharmacies are doing a fabulous job. They will be standing up community pharmacy-led booster vaccination clinics and looking at what pop-up sites we can offer across the city. So all of that work is going on behind the scenes, and as soon as we have those sessions organised, then clearly we'll be able to publicise those, and people will be able to see that there are a lot more York appointment slots. But what this slide does try to show you is the variation really in uptake of the vaccination, the first, second and booster vaccination by population group. The Outbreak Management Advisory Board do oversee this information, and they've received detailed reports as to the work that's going on across the city to target particular groups. Obviously, this is partly influenced by age group, because people have been eligible for boosters at different times, etc. And so this graph does show that, with the younger age groups, for example, only now becoming eligible for their booster vaccination. We also review this data by electoral ward. Again, the Outbreak Management Advisory Board receives detailed information on this. Clearly, this is influenced by demographics as well. So those parts of the city that have a high student population, for example, will obviously have a lower uptake of boosters, for example, because they will only just becoming eligible for those vaccinations. So the ward data is influenced by the makeup of that particular population. So just to say something about Omicron then, I'm sure that you'll be aware of quite a lot of this. There's been a lot of media coverage over the last few days, but Omicron has been declared by the World Health Organization and by the UK Health Security Agency as a variant of concern. It's the only way to identify whether somebody who's tested positive has Omicron is for full genetic sequencing to be carried out of that test that's been done. It takes can take up to 10 days for that sequencing to come through. So the laboratory does look for indications as to whether this could be Omicron. So if the S gene is not present, that can be classified as a possible case of Omicron. It won't be confirmed as definite Omicron until that sequencing has been done. What it is important to recognize, the final point there, bullet point, is that only up to about 30% of PCR tests are sent for full sequencing. And so the numbers that are being reported in the press are not a true reflection of how much Omicron we have circulating. So today, for example, the most recent data I have nationally is that there are 4,713 confirmed cases of Omicron nationally, but UK HSA estimate that there are probably around 200,000 cases of Omicron. And we know that at the moment, the case numbers are doubling every 2 to 2.5 days. So you can see how quickly those case rates are rising. So at the moment, the data that I'm seeing is that there are a small number of possible unconfirmed cases in Yorkshire and Humber, including York. And I know the media is very interested in reporting actual numbers of cases, but I would encourage, committee members not to be sidetracked by the confirmed numbers, because, as I've said, there'll be a tip of the tip of the iceberg, really. So what do we know about Omicron at the moment? So there have been reports that you will have seen, I'm sure, from South Africa and various scientists arguing that Omicron causes a milder illness. But it really is important to understand that that is not being confirmed. We do not know if Omicron is a milder illness. And so it can't be taken for granted, because until we have more information, we don't know whether it's more severe or not. What the data we are starting to see is that South Africa are now starting to see a rise in hospital admissions. And also we're seeing admissions now in the UK as well. So I think the data I saw today was 10 hospital admissions from confirmed Omicron and one confirmed death. But obviously there'll be more information coming out on a daily basis. So I would encourage anyone listening not to be lulled into a false sense of complacency, really, to assume that Omicron is a milder form of the disease, because we don't know that yet, and we can't say whether it is or it isn't. We know that it is more transmissible. It is more transmissible than the Delta variant. And as I mentioned, the growth rate and the doubling time is really quite significant, with an expected doubling of case numbers kind of every 2 to 3 days. So it is very much more highly transmissible. We know that the vaccine is effective against it. No vaccine is 100% effective. But what we are seeing with the data that's come out so far, Pfizer and AstraZeneca have published their data so far, that 2 doses of the vaccine provide some protection, but really people need to have that 3rd dose, that booster dose, to have maximum protection. And laboratory tests indicate that Pfizer boosts protection by up to 75% and AstraZeneca by 70%. What that is telling us really is that even those people that are vaccinated, you still have to follow the kind of basic infection control advice that we've been giving throughout the pandemic. If you think of infection control measures as being looking like Swiss cheese, there isn't one single thing that will provide the best protection against COVID. It's vaccination, and it's wearing face coverings, and it's good ventilation, and it's hand washing, is reducing the number of people that you come into contact with. So all of those things working together provide the best protection against COVID. And in terms of treatments, we don't really know that yet. There are obviously COVID treatments that are available. There are antivirals, and there are other treatments that we know are effective against COVID. There isn't any reason to suspect that Omicron will not be affected by those treatments, that they won't work. But we haven't got any strong evidence one way or the other around that. So we can't say definitely at the moment whether those treatments will be effective. Just to say a little bit then about how Omicron is detected, because there's some confusion around this. A lateral flow test will tell you whether you are infected with COVID-19, but it won't tell you whether you have the Omicron variant or whether you have the Delta variant. The only way you can tell which variant you have is, as I've said, through that PCR test. I said up to 10 days. This line says that it can actually take up to 2 weeks for it to be confirmed that you have COVID. And so the changes to the guidance that the government have introduced really reflect that. And the advice that's being given now by government is the same whether you have whichever variant of COVID that you're notified by Test and Trace that you have. So there's been changes to travel guidance. There's been changes to some of the COVID regulations. So from today, it's important to also from Friday actually it was important to wear face coverings in certain settings. It's a mandated requirement. That list was added to on Friday, as we've said. So now it's a statutory requirement to wear a face mask in public buildings, not hospitality as things stand at the moment. New guidance around the wearing of face coverings in secondary schools. And also today, an announcement from government that from tomorrow, whether you're vaccinated or not, if you are contacted by NHS Test and Trace and you are told that you're a contact of a positive case of COVID, then you have to undertake daily lateral flow testing. And that applies to everybody over the age of 5. So that's a change that is coming in from tomorrow. And then, as we've discussed, the booster is now recommended for everyone over 18. So it's been age restricted up to now, but now everybody over 18 is eligible for a booster, provided there is that 3-month gap between their second and their third. 12 to 15-year-olds will now be offered a second dose of vaccine. So so after a 12-week gap, 12 to 15-year-olds will be having a second dose. We thought they would only have 1 dose, but now that's been extended to a second dose. From today, anyone who can work from home and can do their job from home should do so. And then from Wednesday, subject to this being passed by Parliament, there'll be the introduction of the COVID pass to certain venues as well. So that's the end of my presentation, Chair. A lot of information in there, and I've tried to go through it quite quickly, so happy to take any questions.
Thank you very much, Sharon. That's really helpful, and you set out quite a number of things there that I'm sure members will want to ask about. The one first question that I just wanted to pick up myself, and actually, funnily, whilst you were talking, I was texted by my partner who's managed to book me in for a booster jab, because I've spent all day trying to log on to the website without luck, and she's managed to do that. But you were talking about the rollout of possible places in York that might be available for further appointments. Do you know whether there are any plans for any of them to be walk-in, or at the moment is the expectation that you just want to try to increase the capacity for booking a jab? Because I know that, as I say, the website obviously over the last 24, 48 hours has been quite overloaded.
So yes, I think it crashed for a while because I think most people will be aware there's just one single national booking system with everybody trying to get onto that. The intention is to set up pop-up vaccination clinics as we had in earlier phases of the pandemic. The only reason it changed to a booking only system was because there was such a high demand, and we were having complaints from people who were having to queue for many hours in the cold for a vaccination program. But the work that's going on behind the scenes is doing two things. We're looking at where we can put pop-up clinics, and the council is supporting that as well, in terms of what we can do to increase venues and access to pop-up clinics, but also booking appointments. The government, you may be aware from the national media, has given the NHS permission to put some routine appointments and treatments on hold. That is really to try and release workforce capacity to be able to have a really, really big push on this booster program and get as many people to have their booster as possible. So yeah, we're looking at pop-up non-appointment clinics as well as extending the sites that can be booked as well.
Thank you. So over to members for questions, and there's a couple of people with their hands up already. And as I say, if you just put your hand up within the Zoom function, and I'll bring you in order. So first was Councillor Orrell.
Thank you. Sharon, previously we've collected our lateral flow tests from the chemists. Wife went in today, there weren't any available, and I think you have to book them online to get them. How does that work for people who can't get online?
So people can also collect lateral flow tests from the council sites. So you can order them online. Obviously, they have to be posted, and the postal system is very busy at this time of year, as we know. So so the recommendation is that on an ongoing basis, people who can should book online and have them posted out. But our council-run testing centres also do a collect service, and those details of where people can collect tests are on the council's website, or they can ring the council's COVID helpline to get information around that as well. So we're expecting there to be high demand on the lateral flow test, particularly as people who have been notified they're positive contacts are going to have to do daily tests. So that's one of the other pieces of work we're doing at the moment, Councillor Orrell. We're working with schools and pharmacies, our own testing sites, to make sure that anybody who needs a lateral flow test can access one as easily as possible. And of course, we also have our assisted testing service that we run, and the public health team runs on behalf of the council. So if anybody isn't confident to do their own test or needs some assistance, they can access one of the council run sites and get an assisted test. So we'll be reminding people of how they can access those services as well.
Thanks, Sharon. That's very helpful. Thank you.
Okay, next was Councillor Fenton.
Thank you, Chair, and thank you, Sharon. Just looking at the data that you showed, there's still some concerning figures around the proportion of younger people who are entirely unvaccinated. I think the 30 to 39-year-old age group had 75% had a first vaccination. Obviously, that leaves quite a large number of people who are unvaccinated. Are you hopeful that the emphasis on boosters will actually help boost that cohort of residents who haven't received a vaccination at all? I just wondered what more we could do as an authority to make that cohort of people aware that what is available locally, because I wouldn't want them to be put off by tales of people trying to log on and book a booster jab and being unsuccessful. So I'm just conscious we don't lose sight of the making the offer to the unvaccinated group.
Absolutely. So so we estimate there are about 30,000 people in York who haven't been vaccinated at all. And, you know, for those people, it's, you know, I would say that it's never too late to have your first vaccination. It is an evergreen offer, as the NHS describe it. So for those people who may perhaps have not come forward for a vaccination for whatever reason up to this point, you know, it's not too late to have your first vaccination. And even though we're saying that to get maximum protection from vaccination, you need to have had 3 doses. 1 dose will provide some protection. So, you know, I wouldn't want anyone to be put off from booking their first vaccination. And I think, you know, just picking up the earlier point, as one of the reasons why I'm really keen that we have walk-in vaccination sites available for people as well, because we know that not everyone can access a booking system either by telephone or online, and having walk-in facilities where people can walk in at their convenience, and also in venues that are easy for people to get to, that they don't have to travel to Ascombar mass vaccination centre, but they can access a vaccination close to where they live. That is still crucially important. So we're going to be looking at all of that as well.
Thanks, Sharon. And just sort of on that topic as well, because I thought it was interesting in the data that you shared with us around the sort of under 18s, you know, the sort of, I think it was 12 to 15 and sorry, I did jot down the numbers and I can't read my own writing now, but it was that, you know, broadly speaking, the primary school and secondary school age pupils, and obviously that made sense around the fact that a lot of them have either not had any vaccine or have only been able to have 1 dose so far. But then that sort of correlating spike in the 30 to 39 group, which I think broadly was, you know, the parents potentially. Have we done some interrogation of that figure to show whether or not it is actually the people who haven't yet gone for vaccines that are then causing that little spike within that, or is it a little bit more nuanced than that in terms of how that infection rate is sort of replicating, as it were?
So we don't have access to that information. So I mean, it's the same with hospital admissions. We've been asking for data to be collected nationally on to get proper data on the number of people who admitted to a hospital and ITU as to what proportion are vaccinated or not. There is information about that comes out, but it's not collected nationally in a way that will allow us to interrogate that. So we know from kind of the national information that's being collected and shared that you see a higher number of patients that are admitted to hospital who are unvaccinated, and you know we know that from clinicians collecting their own information about that. But the national the NHS test and trace database doesn't allow us, it doesn't collect that information around vaccination or not, and we can't drill down into that and interrogate that locally. So we can make certain assumptions from some of the national studies that have been done, but we can't come up with any reliable picture around that locally.
Thank you. I'm not seeing any further hands going up. So in lieu of that, I guess just a couple of other questions from me before we wrap up this section. First of all, obviously, the guidance that's coming from government is changing at the moment, I think, reasonably quickly. But I wondered whether or not you could give us any sort of sense of whether there's anything that either, whether it be us corporately as the council or just residents more generally, might want to be doing, notwithstanding any government guidance, but just to make sure that we're all as safe as we can over the Christmas period.
So so the advice really is the same advice in terms of people's behaviors are really going to make a difference as to the size of the spike of cases that we see in York. So, the same measures, getting vaccinated, wearing face masks, ensuring good ventilation, minimizing the contact that you have with people, hand washing, all of those things continue to be really important. As I mentioned earlier, I suppose the additional ask I would have is for people to be cautious in terms of meeting family and friends over the Christmas period, particularly where there may be vulnerable relatives and friends. And it's a good idea to have to take a lateral flow test before you meet. So there's nothing in the guidance that says you can't meet, and for all sorts of reasons, people will want to meet up with relatives and friends over the Christmas period. It's normal. That's what we want to do. I'm not saying to people that they shouldn't do that. It's important for families to meet, and I'm planning to meet with my extended family, some of whom I've not seen for 2 years. But it's to be cautious and really encourage everybody to take a lateral flow test. And obviously, if that test is positive, if you have symptoms that could be COVID, then to just take sensible precautions and not put yourself or any of your friends or relatives at risk. Err on the side of caution.
Thank you. And then one final question from me, which is just about symptoms. I had read, and I forget where the source was, that there was a possibility that the Omicron symptoms might be marginally different from some of the other COVID symptoms. And I think possibly it was things like an absence of a temperature, whereas I think having a temperature has been a key COVID symptom previously. Are you aware of any possible changes to the symptoms that people might be needing to look out for in terms of getting themselves tested, or is it pretty much as it has always been, which I think is temperatures, possibly headaches, possibly wheeziness or chest type things, and persistent cough. But obviously you're the Director of Public Health, so if you could just tell us if there's been any variation or change of what people should be looking out for, and then we'll wrap up.
So it's a bit too soon. I think the Omicron variant only emerged a very short while ago. I mean, things have changed so quickly. But I think it's good advice to people that if they feel unwell, whatever symptom they've got, take a lateral flow test. They're free, they're easy to use. Just be cautious. Don't think, oh, well, have I got a loss of taste or smell? Have I got a temperature? Have I got this? Have I got that? If you're unwell with any new symptoms, it's a simple thing to take a lateral flow test. They're pretty accurate. It's very rare you get false negatives from a lateral flow test if it's taken correctly, if you follow the instructions. And so do a lateral flow test. If it's positive, then obviously you self-isolate and you order a PCR test and wait for that result. But I would encourage people to just take a test, and not is this COVID or is it not COVID? If you feel unwell, any new symptoms, just do a test would be my advice, and then it just gives you that reassurance.
Thanks very much, Sharon. That's been really helpful, and I suspect that we may be seeing you again on this committee reasonably soon. But in the meantime, I hope you do have a good Christmas and the family gathering goes well. And thanks a lot for your time this evening.
Thank you.
Okay. So I shall move us on now to agenda item 5 and invite Debbie Mitchell, who is the Chief Finance Officer, and Ian Cunningham, who's the Head of Business Intelligence, both joining us on the screen now. Good evening, both. I think probably simplest, Debbie, would be if you could just give us a very brief overview of the report, which is the Finance and Performance Monitor 2. And then again, I'll just invite members to ask any questions that they may have.
Yeah, sure, not a problem, Chair. So this is the second report of the current financial year and covers the latest finance and performance information. This report follows obviously the main finance and performance monitoring report that was presented to Executive last month, and which highlighted the forecast variations. We are continuing to see those pressures in social care, both adults and children's, and again, both in terms of demand for services and the costs of those services. So that's a combination again of increased complexity in adult social care, and those pressures both within the NHS and the community-based services, all contributing to creating those pressures, particularly in adults. And again, as we've mentioned before, and you are aware, both COVID and those social care pressures are national issues that are being seen in most of the councils, and certainly not something that's unique to York. Work is ongoing to address these challenges, but it clearly remains a very serious situation, and will continue to require a significant amount of work over the months ahead. So the summary position is outlined, I think, in table 1 at paragraph 16, and the detailed analysis of the finance and performance across all areas of the council was included in the annexes to the original executive report, and therefore they're not repeated here. And apologies, we should have listed the executive report as a background paper, and I don't think we did that, so apologies, we must do that next time. And yeah, just been asked to note the report.
Okay, thank you very much. Members, I don't know if anybody has any questions. If you want to just raise your hand. Councillor Fenton.
Thank you, Chair. Just a question around paragraph 30, which Debbie or Ian may or may not know the answer to, but if not, I can follow it up with other officers. It was just the time taken to process new housing benefit claims had increased from 2 days earlier in the year to 5 days in August, and then the following paragraph goes on to talk about staff being diverted from elsewhere to get involved in other work that the benefits team was doing. I just wondered if that that increase in the time taken to process housing benefit claims was because staff were being diverted onto other tasks, and therefore whether we could expect to see a return to the previous 2-day turnaround from the 5-day. I don't know whether, Ian, you've got any sense as to what's happening there.
I can only say commentless, Councillor Fenton. So yes, after speaking to the service, I think certainly they feel that since the team has been diverted, the processing time has gone back to the national average. And I don't think it should be forgotten actually that we've been very good actually at processing information in terms of housing benefit alongside our colleagues at the DWP. I know after talking with David, he's pretty happy that once the team comes back from the COVID grants, that those numbers should reduce. Whether we fully get them down to 2 days again, I don't know. We were really outstanding in that area. compared to other authorities. So yeah, hopefully we'll get back towards that position.
Okay, thank you.
Thanks. I'm not seeing any other hands going up at the minute, so I'll just ask a couple of questions, but do feel free to jump in if, well, don't jump in, but put your hand up and I'll bring you in if if we get there. The question I just wanted to ask, and Debbie, you've sort of alluded to it, I think, in so much as that there were more detailed papers behind this paper, but the summary table that's on page 24 of our pack, at paragraph 16, pretty much all of the projected overspend seems to come from the People Directorate. Are you able to give us an indication of what the breakdown is between adults and children's within that? So I think it's 8.5 million overall. Is it sort of roughly 50-50, or is it skewed particularly towards adult or towards children?
I'm just trying to get the numbers. I haven't got the numbers in front of me, the further breakdown, actually, because the People Directorate doesn't split directly between adults and children's anymore. There are areas of overlap. So commissioning, for example, is overlap. So we don't have that direct split, but it is predominantly children's, actually, is the biggest area of overspend. Although adults is catching up. I have explained it's not a competition, and they're not supposed to be competing in that way. But yeah, adults is hot on their heels.
And if it is children, then is it still the case? Because I think previously the significant area within children has tended to be sort of looked after children placements, particularly out of area placements, as being kind of big areas, whether with financial pressures. Is that still the predominant area of pressure?
It is still, yeah, it's children's placements and agency social work, agency staff as well. Right. So there is still an ongoing difficulty in recruiting experienced children's social workers. As you know, they can only hold the limited case number until they've got that relevant experience. So experienced children's social workers are still difficult to recruit and retain. So we are still using relatively expensive agency workers. But yes, and the other pressure is the increased population in looked after children.
Thank you. Councillor Pearson, you had a question.
Thanks, Chair. Thanks, Debbie, for your report. I was just going to ask around the budget. Obviously, you've got in paragraph 16 around the financial pressures of 4.6 million after mitigation. I'm just wondering, is this year to date, or is this about next year? And if you could explain that to me, and then obviously just, if you could, what's happening next year?
So the 4.6 million in this report is just for the current financial year. So that is our forecast position. So that is what we forecast will be the council's position as at the 31st of March 2022. And the reason that's a significant concern, because we would expect to be on balance by the end of the financial year. Now, in a normal kind of year, remember those, we'd start high and then the forecast kind of gets better during the year, but what's normal now? Not this, certainly, but that has not been the case anymore. So normally it would start quite high and things would start to turn around, would start to have an impact, and it would get better as the year went on. We're not seeing that at the moment. We're seeing it sort of stay the same, slightly worsen in some areas, slightly improve in others. We're not seeing the improvement that we're used to seeing as the year goes on. Now, that's not to say it won't improve before year end, because I do think it will. And there is a lot of work ongoing by many officers across the council to try and manage the budget position. So I don't by any means underestimate the amount of work that's going on across the council to try and manage, to control costs, to manage the position. So this is the forecast for the current financial year. In terms of next financial year, you'll know that the budget, the decision session reports, so the budget papers are published, and the decision session meetings are ongoing throughout this week. So we've had one this morning, and they'll all be finished by, I think, the end of Thursday this week. And those reports are considering savings for next year, as well as the growth and investment, particularly in social care, that we have recommended is required to try and make sure that the budget is resilient in future years. Does that answer your question, Councillor?
Yeah, thank you. I just wanted to understand, if we're down 4.6 million at the end of this year, that presumably comes out of our reserves. And how does that leave us set up for the year ahead, I guess is the question.
Yes, sorry, I should have mentioned. So the reason that this is such a serious issue is that if we cannot pull the position back to a nearer balance, then yes, you're right, we would have to call on our reserves to fund the overspend. We have got enough in reserves to fund the overspend, but we've only got just over 6 million in the general unallocated reserve. So there is enough in there, but then that would, in my view, as a Section 151 officer, that would mean that the reserves were lower than I would want them to be, the unallocated reserve. So that would put pressure already on next year's budget, that we would then have to look at where we could look for the next year's budget to increase reserves, to bring that general unallocated reserve back to a level which was suitable for a council of this size and with the type of risk that we've got.
Thanks, Debbie. Not got other hands up at the moment, so I'm just going to ask a couple of questions myself. But as I say, if members do have further questions, do pop your hands up. I think this is probably a question for Ian, but I also appreciate it might be a question which is difficult to answer sort of easily, and it might be a case of we'll need to go away and look at this. But paragraph 27, which is around sickness absence and some of the data around that. And it just notes that there's been a small increase in sickness in the last few months, particularly around frontline services. And it raised to me a thought. I know the question has previously been asked in this committee around whether or not there's any concern around presenteeism when people are working from home, or indeed whether actually people are able to work perhaps when they ought to be not working and being, off sick. So, whether the data is in any way skewed. And I just wondered whether we are collecting data that we can separate out as to whether people are working from home or whether people are working, either in West offices or indeed sort of out and about in the city in some sort of frontline capacity, and whether there's any difference in those data around absence.
Okay, so lots of questions in there in one go. So I'll try and answer.
It's my style, just chuck a few in there.
Okay, so yeah, you're absolutely right. The report states that sickness has slowly risen up, and this report was at Q2, and that's continued on a little bit into this last couple of months. Sickness directly relating to COVID, to relate back to Sharon's presentation before, is around about 20 or so people within the authority. So not a huge amount of people off with direct COVID symptoms. Yes, the organisation does monitor the main place of work, but it became quite difficult because obviously we have lots of people working in lots of different various hybrid ways around the authority. So we do keep an eye on the main place of work. And yes, you're right to point out within it that sickness levels do differ actually between people who might be from a depot-based service, who might be working in a care home or through provider services, and people who are at West offices. And we're certainly seeing slightly higher level rates within the frontline services, people that are working directly with the public. So we'll see that within some of those frontline services at the depot that we've mentioned there, highways. We'll see it within provider services, adult social care, and some parts of children's specialist services. So that difficult rising sickness rate and some of the pressures that Debbie was describing in the previous question is a really difficult mix, isn't it, for the authority to tackle at any one point. I'm sure we can have a look into that in a little bit more detail in terms of place of work and sickness rates, and something happy to share around the committee via email between the meetings.
That would be helpful. It might also be something, I think in a couple of months' time, we've got organisation development and things like that coming up on the agenda. So it might be something that we can tie in with that, but I'll perhaps have a conversation with you about what might be appropriate to bring to the committee on that. Councillor Pearson, you've got your hand up.
Thanks, Chair. Yeah, it was just a question around what sort of benchmarking we do against other authorities, and how is York doing, I suppose, in terms of in financial terms, and especially in sort of adult and children's compared to other authority or comparable authorities, I suppose, is the most relevant question.
Sorry, Councillor Pitt, is that in terms of our financial performance in respect of?
I guess how are other authorities presumably seeing the same COVID pressures, seeing the same pressures on adult social care, children, etc. So how is York's financial performance, I guess, particularly in those regards, compared to other authorities?
Yeah, we haven't done, unless Ian tells me differently, we haven't done any benchmarking in terms of percentage overspends of budget or anything like that. This my intelligence comes from, we have regional meetings both with West Yorkshire and the North Yorkshire kind of finance managers. And obviously it's only really county in North Yorkshire, but certainly in West Yorkshire, and everybody's, now people experience it differently. Sometimes it's more on adults, sometimes it's more on children's. That is as much actually to do with where your base budget is rather than anything else. But I think as a region, certainly Yorkshire and Humber are experiencing the same sort of pressures, both in adults and in children's, and particularly in children's, it's around sufficiency of placements. So there are simply more children and young people needing those places than there are those places in existence, if you like. And so that's why we're experiencing those expensive sort of out of area type placements where children are having to be sent, you know, to various places away from the city just because they don't exist. That there are just not enough of them in the country, never mind enough of them locally to us.
Thanks, Debbie. I've got another question for you, Ian, which again, I don't know to what extent this is information that you have at your fingertips or whether it's information that we need to go away and find out a little bit more about. But it's actually the following paragraph, paragraph 28, which is around customer services and contact rates and what have you for people. And we've talked again previously in this committee, we have sort of raised some concerns about the lengthening time that it takes people to get through at the moment. And I think we talked about the various pressures that there are on the customer centre. I just wondered if we have any data, because the number that jumped out at me here that really concerned me was, if I'm reading it correctly, we're answering 64% of the phone calls in total. So presumably we're not answering 36%, so that's just over a third of the people who are trying to contact the councillor not getting through. Do we have any data on whether they then try again at a later date and are able to get through, or where they go separately, or is it just a case of they've called in, they've not got through, and we then don't know what happened to them subsequently? I know, I'm sure quite a few of the members on the screen will have had people in recent weeks who've contacted them to say we've not been able to get through. I've certainly had one or two, but it would just be useful to know how the council collects any information on that at all.
So the 36% of people that haven't been answered, that doesn't absolutely mean that they've dropped off because there's a timeliness issue or that we haven't been able to deal with them. That might be a choice issue actually for why they've not been answered, so people coming away from the call. What the council do monitor is on all the different call lines into the council, all the different ways that we segment the contacts coming in. We monitor number of calls, timeliness of pickups of those calls answered, and then we get customer feedback around that. Now, having all those statistics to hand is difficult because there's not 100 queues, but there's 50 or 70 queues or so of information. I'm sure I can put together something on that. I think it's absolutely right to say though that the pressures that have been on the customer centre that we described in Q1 continue on into Q2 and then recently as well. And we've seen that within the housing benefit performance figure, which is why we leave it within the packs. But the timeliness of answering calls, the amount of seconds that it takes to get there has significantly increased between Q1 to Q2. So something I know that the teams are looking at, Another thing alongside the sickness, I'll send around a quick table to the committee with a couple of key stats there over the next week.
That would be really helpful if you could, Ian. Can I just clarify, when you say it could be a choice issue, does that mean, for example, that they might have gone through a menu and found that they've received information that they needed, or do you mean that they've decided that actually we've been on the line too long and we're choosing to hang up?
I think a bit of both. So
Right.
They may have got the information they needed. They might have been on the line. Somebody might have knocked on the door and they've decided to drop off the call. I mean, all sorts of reasons there.
And if it goes through to a voicemail, would that count as an answered call, or would that count as a not answered call?
I'd have to check, but I'm pretty sure that it would be classed as a not answered call. But I'll check that one out.
Yeah, if you could clarify that as well, that'd be really helpful. And so again, members, I think this is perhaps something that we as a committee might want to return to in a bit more detail, because it's certainly something that I've had quite a lot of correspondence on over the last 2 or 3 months from residents, and I'm sure others will have done as well. I didn't have anything further that I immediately wanted to raise this evening. Obviously, we're running into budget season. You already talked about the various decision sessions that are taking place this week. I'm not seeing any other hands. So I think the one other thing I would just ask if you could just very briefly do for us is just explain to us what the process is between here and the setting of the budget. And obviously we have Budget Council coming up at the end of February. But if you could just, in a very sort of brief overview, just let us know what the steps are that get us to that point, and then we'll let you go for the evening.
Yeah, sure. So these decision sessions are part of the consultation, really, and they're a bit misleading, really, call them decision sessions, because they're not actually making any decisions. They are just considering the proposals and, in the context of the wider budget. So the decision sessions will, as part of the consultation, opportunity for residents and other stakeholders to speak at those meetings, to contribute to feeding their views to portfolio holders, executive members. Once all those meetings have taken place, as you say, we'll be preparing the reports then for February executive, which is, I'm not sure the dates, because we've moved Budget Council out of its normal week. I'm a bit sort of, a bit skew with, but anyway, I think it's the 7th of February executive. So let's go on to executive, and at executive there will be, as well as the Monitor 3 reports for revenue and capital, there will also be a financial strategy report. There will be one report that covers the capital budget. There will also be the treasury management strategy and the capital investment strategy. So a whole suite of budget reports that consider all the issues together. And then I think it will be executive that will then recommend to full council, and then full council will have its usual debate around all the different elements of the budget, opportunity for opposition members to put forward, the opposition party to put forward their amendments and so on. And that is, I think, on the 17th. I'm sorry, I'm totally wrong with the dates because we're not in the same week. So do bear with me, just check the dates. So yes, it's the 17th of February, isn't it? Full council, and so the full council will formally agree the budget and the council tax at that point.
That's really helpful, Debbie. As I say, I'm not seeing any other members with any other questions. So Debbie and Ian, thanks both of you for your input this evening. Ian, if you could just circulate those couple of things that we've discussed in due course, and then as I say, we'll let you know if we want to dig into anything in any further detail. But otherwise, if I could just thank you both and wish you both a Merry Christmas if I don't happen to see you before then.
Thank you very much.
Thank you, Chair. Bye.
Thanks. So members, it's 7:15, and ordinarily on a Zoom call I would look to take an adjournment around this sort of time, but I'm looking at the agenda. I think there's only a couple of other items which I'm expecting will be quite quick. So unless anybody's desperate that we take 5 minutes, I'm going to propose that we just plough on through, because I think we'll be there soon enough. So if I move us on then to agenda item 6, which Dawn, I think you are going to just introduce. That's the schedule of petitions.
Yeah, this report, Chair, is the first schedule of petitions that I think you've received since January 2020. So we thought it was timely that we gave you an update on the petitions that as you can see in the schedule, we've amalgamated that we believe the council has received. That includes those petitions that obviously get submitted by members to council, and it includes any others that are reported onto the schedule. So in terms of your role, just to remind you on your role in relation to those petitions, basically, it's not obviously to make any decisions in relation to the petitions themselves. It's to look at the process and see if you're satisfied with, the process that's been set out there in that schedule in relation to any of them, or whether you want to suggest any other considerations, like bringing any of them forward for consideration by yourselves, etc., if that was a need. I mean, history tells us a lot of these petitions are kind of fairly formulaic, and you haven't felt the need to do that in the past. As a result of that formulaic comment that I just made, I know previously we have looked at and thought about, and obviously we haven't done for some time given the COVID pandemic, the possibility of, and that's the other part of this report, do you want to suggest reviewing the way you are currently receiving petitions at the moment? If so, there would be an opportunity for you to do that, perhaps through the ongoing constitutional review, to suggest we look at it, because you may think that at the moment, Chair, it's not particularly the best use of your time in all areas. I'll leave it at that, Chair, and just respond to any questions where I can.
Thanks, Don. That's helpful. Just so that members are aware, we've obviously had previous conversations around the schedule of petitions on a couple of occasions pre-pandemic, and one of the things that was talked about was where we have things like Res Park petitions, which have a very clear route by which they travel through the council. Does this committee need to have oversight of that, or can they perhaps go as an appendix to a exec member for transport decision session, so that there is a public record of them having been received and what the action is going to be? I've put that forward as a suggestion for the working group on the Constitution to consider whether or not those sort of well, I think, Dawn, you said formulaic. I think they're almost sort of I'm looking for the right word, but they're very much petitions that are asking for a set course of action that is a well-established course of action, as opposed to a petition which might be on a particular topic or a particular issue with a particular set of requests to the council that are unique to that petition. So my sense would be that that's something for the Constitution to consider based on the input that I've given them within that review. Depending on what they come back with, then we may want to look again post-Constitution at whether there's any implications for this committee in terms of how we receive things. But my sense is I'm happy that we see that overview of the kind of unique petitions, but that anything that's a regular occurrence, I don't need to know that there's a Res Park petition for one street or another street or another street, other than perhaps having that overview of saying, are these things being done in a timely manner, and not just all sort of building up and not being actioned. But I think that's probably for the exec member to consider rather than us, perhaps. So unless anybody has any further comment or question, Councillor Norman, I see your hand go up.
Just a small query. Petition 148 appears to have no signatories. Is that an error, or?
What page are you on, Councillor Norman?
It's page 38.
I'd clocked that one as well, yes.
Sorry.
No, I'll just have to get that document up, because of all the documents I've got on the I haven't got that one open.
It is one that has been previously reported on, actually. It's stop plans to cut cars from using the city centre. And we'd previously had this reported in 2019, which is when it was launched. And I believe at the time there was one signatory to it. Right.
That looks like that's just an error. It looks like it's simply an error, because it can't not have any. For it to be a valid petition, it's got to have at least one signatory to it. So I suspect that's an error. And one of the things with the annex, of course, is the information is gathered from a kind of generic site that all officers across the authority input into. It's not that Democratic Services maintain that site particularly. So whilst we do our best to check the robustness of the information, we obviously haven't in this particular case. And that's me, I haven't, not the team. So apologies, we'll look into it, Councillor Norman, and see what the exact number of signatories it is for that one.
No worries at all, thank you.
Councillor Orrell.
Same question, Chair, so it's just been answered.
That's good. The only other question that I had, but again, I think this might be something to review going forward, but once these have come through and been seen by the committee, so this whole list of petitions here, will these automatically then not come to this committee again, or would we need to do anything to kind of tick them off, sign them off and say, yes, we're satisfied that that's being dealt with and we don't want to see that again? What's the usual process at the moment?
So we haven't done that formal signing off bit, Chair, in the past. We've just normally just assumed that from your lack of comment on the ones that you've seen today, and then removed them from, we don't remove them from the general set schedule that I've just referred to, because that's the obviously up-to-date record of petitions received, etc. But from your reporting, we would remove them. But if you wanted to introduce a system that you formally acknowledge that and signed them off similar to the way we do for scrutiny, or have done in the past, should I say, when we had a plethora of scrutiny review and recommendations, you will all remember that your individual scrutiny committees have looked at the outcomes of those reviews and the recommendations and signed them off on a 6-monthly basis. So if you wanted to formalise a process, something similar to that, we could do so, Chair, but we have automatically just taken them off, so that you're not cluttered with the same information again.
So again, I think it's not a thing for us to make a decision on now, but I think this is something for us to return to. What I would perhaps think might be a sensible way of looking at it would be to assume that we're happy to remove them unless we've noted them as ones that we want to keep an eye on. And so we make it a positive choice of saying, actually, we'd like to keep, petition 156 as something that we're monitoring for the time being, but all of the rest of them can we're satisfied they're being appropriately dealt with. As I say, ordinarily, I think we would receive a schedule of petitions more regularly than we have done over the last couple of years. So it wouldn't necessarily normally be as long as this, unless suddenly everybody decides that they want to submit a petition to the council, of course.
Yeah.
Okay, so if members are happy that we leave it at that, but with perhaps something to return to post-constitution to think about how we handle petitions going forward, depending on if there are any amendments within the constitution, then I will move us on. I think everybody's happy with that. So if we go on to agenda item 7, which is the Scrutiny Review Support Budget 2022-23, which members will recall comes to us every year at around this time. Dawn, I don't know, again, if you want to just give us a very brief overview, and then we do have a decision to make on this in terms of what we want to recommend to Executive.
Yeah, the only comment I'd make, Chair, many members, perhaps not all of the current makeup of the committee, have seen this report in the past, but some of you will have done. Very similar reports. You have a constitutional right currently in your terms of reference to be consulted on what we call research support budget you would wish to see in terms of the amount you might wish to recommend to Budget Council. The only thing I draw out is the same comment I draw out every year probably, which is the lack of spend against the budget and the fact that over the last few years, you've looked to diversify how you might use it. For instance, we talked about diverting it to some spend on training for members. There is a separate training budget for members, you will all be aware, and that's equally small. So sometimes we have in the past used it kind of to bolster the training budget on scrutiny for members. Obviously, we've been in a situation where you really haven't had the opportunity to do a significant number of reviews over the last couple of years, for one reason or another, led by the pandemic and the resulting problems arising from it in terms of resources, etc. So you clearly haven't spent any again in the last year. as a culminating point. So I'd urge you, in making any recommendations, to think relatively cautiously about any amount you might wish to recommend to council, given that history of, or lack of history of spend. Well, that's all I want to say at this stage, Chair.
Thanks, Dawn. I will just, you've made mention of it. Pre-pandemic, we had been in discussion with the chair of climate scrutiny, because I think that he was keen to commission some research that was going to be spent from this, and obviously that wasn't possible to go ahead. And we'd also made some steps towards looking at some scrutiny training for members around 2019. I think I'm certainly looking ahead now to 2023 and sort of wondering whether or not training in the next year will be appropriate, but certainly thinking about what the induction will be for new and continuing members in the post 2023 elections. I would like us to be looking at a more comprehensive package of training for scrutiny members in terms of you know, what scrutiny is about, what scrutiny is here to do, and what members can get from scrutiny. Because I think certainly in my own experience, it is something of a something that was unusual at first and took a year or two to really understand what scrutiny was about and what the opportunities might be. Whereas, you know, it would be nice to think that members could hit the ground running, you know, post 2023. Councillor Fenton, I see your hand up if you want to just make any comment.
It's our annual discussion about the scrutiny budget. I recognise that there's been very little, if any, spends. I would be slightly nervous about having no budget whatsoever, because it would then, to my mind, make it far more difficult to then reinstate something to actually do something meaningful along the lines that Councillor Crawshaw suggested. I think there will be scrutiny work over the next year that may well benefit from some investment into whether it's internal resource. I know often in scrutiny we're working with council officers who are a lot of the time trying to spin the plates in their day job and just don't have the time to work with members of scrutiny. And I'm not sure we ever really have the conversation around, well, can we get someone in for a couple of days to do some of the spade work to help move things along? So there probably have been and will be opportunities for us to make use of that funding if we know how to. I'm not sure I would. So my suggestion would be option 2, to retain the current budgetary support, and in terms of explaining why, for the reasons I've just given.
Yeah, I think we've discussed previously the support that's available for scrutiny in terms of dedicated officer time, and I think that that's certainly something that I'm continuing to raise as a concern in terms of, you know, obviously we previously have had dedicated named scrutiny officers, and obviously there's been some changes in terms of the officer support that's available both through democratic services and through the other directorates in terms of time made available. And so I think I would certainly continue to be pushing for that dedicated time to support scrutiny, whether or not that's via a named designated officer or just it being very clear that X number of hours in a day or in a week or even in a year. At the moment, I'd take a few hours in a year. But I think that that's probably slightly distinct from what this budget is for in terms of you know, the support that might go into scrutiny reviews. But I would agree Councillor Fenton with what you're saying about the recommendation. So I don't know if that was a proposal or if you'd like me to formally propose it. I'm happy that it's recorded either way, but if it's the chair and the vice chair that are proposing that we go with option 2, recommendation 2, I will just ask for a show of hands for all those in favour of that.
Yeah.
That's unanimous. So we'll put that forward to executive, and as I say, I will continue to ask for more dedicated time from officers to be able to support the scrutiny functions. So I see from Councillor Fenton, he's just, sorry, not Councillor Fenton, Councillor Pearson, he's just put a note in the chat to say that he's had to leave at 7 o'clock, which was the time that he said he was having to go. We just have a couple of quick items to bring forward now. So agenda item 8 is the work plan for scrutiny. This is the provisional work plan for the scrutiny committees for January and February of next year. There may be 1 or 2 tweaks and changes as we finalise agendas, but unless anybody has any questions, that's just there to note. Not seeing anything from anybody, in which case I can then move us on to agenda item 9, which is urgent business, of which there is none. And so that leaves me with only one other thing to do, which is to wish everybody a very happy Christmas if I don't see you before, although of course we do have full council, so all members, I will be seeing you on Thursday, but for those of it and yourself, so in fact I'm prematurely wishing you all well, have a
virtually,
very
Chair, virtually.
So I hear, yes, so I hear, but I think we'll await the formal announcement of that as I was picking up as we were going through this meeting. So thank you very much, everybody, and I will draw this meeting to a close.